Which of the following is the main limitation of using an intra-aortic balloon pump, ABCP, for circulatory support? A. It does not provide complete circulatory support. B. It requires the patient to remain completely immobile. C. It is contraindicated in patients with aortic stenosis. D. It increases the risk of hemorrhage due to anticoagulation therapy. Answer: A. It does not provide complete circulatory support. Explanation: the ABCP provides partial circulatory support by improving coronary artery perfusion and decreasing afterload, but it does not fully support the circulation, especially in cases of severe heart failure. It is often used for short-term support, such as during recovery from myocardial infarction, but it does not replace the heart's function entirely. In patients receiving mechanical circulatory support, which of the following is the most common cause of failure of the mechanical support device? A. Hemolysis. B. Infection. C. Thromboembolic events. D. Mechanical malfunction of the device. Answer: D. Mechanical malfunction of the device. Explanation: while infection, hemolysis, and thromboembolic events are significant concerns in patients on mechanical circulatory support, the most common cause of failure is mechanical malfunction of the device. This could result from issues such as pump failure, power supply problems, or other mechanical malfunctions of the VAD or ECMO system. Device malfunction can lead to inadequate perfusion or other complications. The role of the ventricular assist device, VAD, in a patient who is a candidate for a heart transplant is primarily as A. A long-term replacement for the heart. B. A bridge to heart transplantation. C. An alternative to heart transplantation. D. A treatment for chronic hypertension. Answer: B. A bridge to heart transplantation. Explanation: in patients who are candidates for heart transplantation, the VAD serves as a bridge to transplantation. It provides circulatory support while the patient waits for a suitable donor heart. VADs are not used as permanent replacements unless the patient is not a candidate for a heart transplant, in which case they may provide long-term support. A major complication that can occur during the use of extracorporeal membrane oxygenation, ECMO, is A. Systemic hypertension. B. Severe hyperkalemia. C. Air embolism. D. Cardiac arrhythmias. Answer: C. Air embolism. Explanation: during ECMO, air can accidentally enter the extracorporeal circuit, potentially leading to an air embolism. Air embolism can be life-threatening if it reaches the heart or brain, causing stroke or other severe complications. Therefore, ensuring that the circuit is free of air bubbles and continuously monitoring the system is essential. In patients with a left ventricular assist device, LVAD, the most common cause of sudden pump failure is A. Thromboembolic events. B. Infection at the surgical site. C. Mechanical failure of the device. D. Low blood pressure. Answer: C. Mechanical failure of the device. Explanation: mechanical failure of the LVAD is the most common cause of sudden pump failure. This can result from problems with the pump itself, such as a malfunctioning motor or failure of the power supply. While thromboembolic events, infections, and hypotension are significant concerns, they are less likely to cause sudden pump failure compared to mechanical issues. Which of the following patient populations is most likely to benefit from the use of an intra-aortic balloon pump, ABCP? A. Patients with acute kidney failure. B. Patients with severe aortic stenosis. C. Patients with acute myocardial infarction and cardiogenic shock. D. Patients with chronic heart failure and preserved ejection fraction. Answer: C. Patients with acute myocardial infarction and cardiogenic shock. Explanation: the ABCP is most commonly used in patients with acute myocardial infarction, MI, complicated by cardiogenic shock. It helps by improving coronary perfusion and reducing afterload, thus reducing the workload on the heart. It is not typically used in patients with chronic heart failure or severe aortic stenosis, as these conditions may worsen with ABCP therapy. What is the main benefit of using a centrifugal pump in a ventricular assist device, VAD? A. It provides pulsatile flow. B. It decreases the risk of clot formation. C. It is quieter and requires less maintenance. D. It offers continuous, non-pulsatile flow with fewer moving parts. Answer: D. It offers continuous, non-pulsatile flow with fewer moving parts. Explanation: Centrifugal pumps provide continuous, non-pulsatile flow, which is more durable and reliable compared to pulsatile flow pumps. These pumps also have fewer moving parts, reducing the risk of mechanical failure and simplifying maintenance. This makes them an ideal option for long-term support in patients with heart failure. Which of the following is a critical consideration when managing a patient on extracorporeal membrane oxygenation, ECMO, in terms of fluid management? A. Administration of large volumes of fluid to enhance perfusion. B. Strict restriction of fluids to prevent pulmonary edema. C. Maintenance of normal fluid balance to support ECMO function. D. Use of diuretics to remove excess fluids rapidly. Answer: C. Maintenance of normal fluid balance to support ECMO function. Explanation: In patients on ECMO, fluid management is critical to maintaining hemodynamic stability and ensuring adequate perfusion. Fluid balance must be closely monitored and adjusted to prevent complications such as pulmonary edema or inadequate perfusion. A balance is required to support ECMO function without causing excessive fluid overload. Which of the following is the primary function of the right-sided mechanical circulatory support device, e.g., RVAD? A. To provide complete circulatory support for both ventricles. B. To assist in right ventricular pumping and support blood flow to the lungs. C. To reduce the afterload on the left side of the heart. D. To assist the left ventricle in systemic circulation. Answer: B. To assist in right ventricular pumping and support blood flow to the lungs. Explanation: The right ventricular assist device, RVAD, is used to support the right side of the heart in patients with right heart failure. It helps in pumping blood to the lungs for oxygenation and relieves the burden on the failing right ventricle. It does not provide systemic circulation support, which is the role of the left ventricular assist device, LVAD. What is the most common cause of infection in patients on long-term mechanical circulatory support? A. Infection at the central venous catheter insertion site. B. Bloodstream infections from the pump device. C. Pneumonia caused by prolonged mechanical ventilation. D. Urinary tract infections due to catheterization. Answer: B. Bloodstream infections from the pump device. Explanation: The most common source of infection in patients on long-term mechanical circulatory support, such as those with VADs, is bloodstream infections related to the pump device. This is often due to the presence of foreign materials, like cannulas or pumps, that can serve as a site for bacterial colonization and lead to systemic infections.